Witam Was bardzo serdecznie. Przed nami kolejny inspirujący wykład doktora Keegan Knittle na temat technik zmiany i samodzielnego zarządzania motywacją i zachowaniami związanymi ze zdrowiem. Dr Keegan jest adiunktem Wydziału Psychologii Ćwiczeń na Uniwersytecie Jyväskylä w Finlandii. Jego zainteresowania badawcze obejmują podejście wewnątrzosobowe do badania motywacji do aktywności fizycznej, cyfrową zmianę zachowań zdrowotnych i interwencje w zakresie samokontroli osadzone w warunkach klinicznych. Tutaj od siebie mogę dodać, że praca doktora Keegana była motywacją do stworzenia narzędziownika w mojej książce Uzależnienie od słodyczy oraz kart do zmiany nawyków żywieniowych Jem przez wybór. Jest to nagranie z charytatywnej konferencji Uzależnienie od jedzenia od badacza do praktyka, organizowanej przez Fundację FitMIND, której celem jest pobudzenie debaty na temat uzależnienia od jedzenia i sposobów do pracy z pacjentem. Konferencja przeznaczona jest dla dietetyków, psychodietetyków, psychologów i lekarzy oraz studentów tych kierunków, ale także dla osób szukających wiedzy i wsparcia. Zapraszam.
So yes, my name is Keegan Knittle and I'm a professor of exercise psychology in University of Jyväskylä, and thank you for inviting me to speak here. Most of my research to date has been on physical activity promotion and changing physical activity behaviors. But a lot of the principles that apply to changing physical activity behavior also can apply to food addiction and to changing dietary related behaviors. So much of my work focuses on what individuals themselves need to do to make change happen. I'll give you some background. First about myself, and then about the self-enactable techniques. So I'm from Texas in the United States, but I've been living in Europe since 2006. First in the Netherlands, where I did a master's degree and PhD in health psychology, and in that time developed and tested behavior change interventions focused on motivational interviewing and self-regulation, and including training healthcare professionals to deliver this type of interventions. And after that, I moved to the UK, where I started working in the area of mHealth and eHealth, developing mobile applications and websites wherein motivational interviewing and self-regulation interventions were being delivered. Also done a number of meta-analyses, and then in the University of Helsinki became really interested in this within persons approach, really focusing on what the person themselves needs to do to make things happen. And as you see there, much of my research focuses on behavior change interventions. So I'm not sure fully about the background of this audience. I understand that there are to be many practitioners here, as well as researchers. So I'll give a little bit of information about behavior change science, first of all, so that the importance of these self-enactable techniques will become clear. So for a long time in behavioral science, in trying to promote physical activity or change diet, we would deliver some sort of a behavior change intervention. And it wasn't always clear what was going on. So we might have a trial which delivers behavioral therapy versus usual care. So we'd compare a black box to a white box, basically. But there's some problems with this approach, at least in these old school randomized controlled trials. Firstly, it wasn't always clear what's in the box. What is behavioral therapy? What is in that black box? What is usual care? A second problem is if I have an intervention that I'm testing and I call it behavioral therapy, and you have an intervention that you're testing that's called behavioral therapy, are they exactly the same thing? It's hard to say. And another problem is that even if we do have the exact same box, I might give mine a different name. I might call mine behavior change therapy and you call yours behavioral therapy. So from a scientific perspective, this presents problems. And recently, within the past 15 years, there's been a move to try to give names to the techniques, to the individual building blocks that make up our interventions to change behavior. And we call these behavior change techniques. So they're the building blocks of behavior change interventions. And this leads to a much more scientific approach to behavioral change. So if we are comparing behavioral therapy to usual care, we might have behavioral therapy, which includes each of these behavior change techniques. Compare it to usual care, which only includes this giving some information and asking people to set a goal or something like this. So then we can see clearly that, okay, this one, the orange one and the black one, they're not really being tested in this trial, but rather we're testing the effects of these white ones, the yellow one, the green one, the blue one, and the red one, because that's what the usual care group is not getting. So we can identify what the active ingredients are in our randomized controlled trials. And yeah, to sum that up, behavior change techniques are the building blocks of behavior change interventions. And I'm sure that those of you working in practice can list a wide range of behavior change techniques just off the top of your head. But in terms of formalizing the language we use to describe these, our work really began in 2007, 2008, and the first such taxonomy or long list, complete list of behavior change techniques was published in 2008. And in it, there were 26 behavior change techniques. After a few years, it was updated to a 40 technique taxonomy of behavior change techniques. And then again in 2013, it was updated to include 93 behavior change techniques. So the list of options to change behavior has grown over time. Now, while these three papers come from Susan Mickey and her group in University College London, other groups, including from the Netherlands, have made similar taxonomies of behavior change methods, as well as motivational interviewing. The basic motivational interviewing techniques can be listed according to the names present in this article. And these lists of behavior change techniques, basically a menu from which clinicians or practitioners can choose techniques to try to change behavior, have greatly advanced health psychology and behavioral change as a science. But we'll come back to this slide. They're still not perfect. Now, when I talk about behavior change interventions, a lot of what we do from an academic perspective, and it relates also to clinical avenues, is to develop theories of behavioral change. What is it that drives somebody to do a behavior? So for example, if we have a person who is not physically active and we want them to become physically active, we might check about their attitude toward physical activity, what they might expect to happen if they were to increase their physical activity, ask about whether they think they could become physically active, and hopefully get them to form some sort of an intention or some motivation for being physically active. And once we had assessed what the most important deficits were in terms of these factors that predict intention and behavior, we might then have an app or have a clinician to deliver behavior change techniques to try to change these factors in the middle in order to change behavior. So if somebody has a negative attitude toward physical activity, we might try a behavioral experiment where they could try physical activity, have a positive experience with it, and therefore improve their attitude toward physical activity, meaning that they would be more likely to do physical activity in their own time. So this is, if you've heard the term theory-based intervention, this is pretty much what is meant. We have behavior change techniques that are targeting specific predictors of behavior. And the idea is that by changing those predictors of behavior, behavior itself would be likely to change. And among these behavior change techniques that are the most important and the ones from the evidence which have the greatest impact on behavioral change, those come from control theory, so-called self-regulation techniques. And these techniques are very central also to cognitive behavioral therapy and behavioral therapy. with the first of those being self-monitoring, tracking what someone is actually doing. So in the case of food addiction, you might have them track what they're eating. You might have them track how they're feeling when they're eating, what triggered them to eat, these sort of things. And what you see at the bottom here is a screenshot from the taxonomy of behavior change techniques, V1. So there they have the name of it, self-monitoring of behavior. And it says that the clinician should establish a method for the person to monitor and record their behaviors, blah, blah, blah. So you'd ask the person to record daily in a diary whether they brush their teeth, for example. Or you give the patient a pedometer and a way for them to record how many steps they take each day. Then you might ask the person to set a goal. If there's a goal that they want to achieve at the end of the program, you might set sort of an intermediate goal that helps them take a few steps toward the end goal. So again, agree on a goal defined in terms of the behavior to be achieved. Agree on a daily walking goal with the person, or set the person the goal of eating 5 pieces of fruit per day. Once a goal is set, you might ask them to make a plan about when, where, and how they're going to act to achieve the goal. Help them to overcome any barriers that might get in the way of achieving the goal, usually in the form of an if-then plan. If a problem occurs, then how are you going to overcome it? And finally, give somebody feedback on their progress. How well did you do toward achieving your goal? How does this compare to others like you who are pursuing similar goals, and things of this nature? So taken as a whole, interventions that use this set of techniques, goal setting, action planning, problem solving, feedback, and self-monitoring, they're very effective. They're effective at changing physical activity behaviors. They're effective at changing dietary behaviors. They're effective in reducing anxiety and depression symptoms. They're effective in increasing self-efficacy. And they're also effective in increasing motivation for physical activity, at least. Now, all of this evidence comes from meta-analyses, which have assessed interventions that use these techniques and compare them to interventions that don't. And the evidence is quite clear across various behaviors and various predictors of behavior that using these techniques is important. Now, with that said, it's not so that these techniques are effective for everyone. And some research that myself and some colleagues, as well as others, have done really indicates that people themselves have an important role to play in this self-regulation. So during my PhD work in the Netherlands, we delivered a physical activity promotion intervention to people with rheumatoid arthritis. And the intervention was effective. It led to maintained physical activity at group level compared to a control group. We wanted to figure out what was driving that maintenance of behavioral change. And so we conducted a mediation analysis, and we found that the use of self-regulation skills, so using these techniques that I just presented to you, the extent to which people reported using those was associated with greater maintenance of physical activity. So, okay, so people have to do something to make that physical activity maintenance take place. Apologies if you hear a child yelling or crying in the background. My wife is trying to put our daughter to sleep for her nap. So yeah, using these self-regulation skills was important in predicting maintenance of physical activity. Now, meta-analysis also investigated a similar question, and they looked specifically at self-monitoring. How well within weight loss interventions did patients do self-monitoring? And what they found is that the rates of self-monitoring for diet or exercise or self-weighing were only around 50%. So people either only self-monitored about half as much as they were supposed to, or around 50% of people did self-monitoring at all. It varied from study to study. But really interestingly, from this meta-analysis, I admit that it is 12 years old now and probably needs to be updated, but the more that people actually self-monitored their own behavior or weighed themselves, the more effective they were in losing weight, the more effective the interventions were at changing weight. And this is important because self-monitoring is really central to so many processes in this self-regulation cycle. If people do not self-monitor their behavior, then they're more likely to set goals that are too difficult or too easy when they're not based on current behavior. If people are not self-monitoring their diet or exercise or weight, they can't be given any sort of feedback on their progress. And if they're not monitoring situations which led to unwanted behaviors, then it's difficult to solve the problems that were associated with a lack of behavioral adherence in the moment. So self-monitoring is key, and the more people do it, the more likely they are to change behavior and to lose weight in the case of these weight loss interventions. Now, some more research looking at the importance of self-regulation techniques in a large trial targeting physical activity and diet among people with recently diagnosed diabetes. Some former colleagues of mine examined how often people used the behavior change techniques that were given to them, and there were 16 behavior change techniques included in this study. And the more people used behavior change techniques, the more likely they were to lose weight. So you see here, people who used all 16 behavior change techniques had greater weight loss than the control group, and much more than people who didn't use the BCTs at all. So you see that the control group actually outperformed people who didn't enact these BCTs on their own time. And again, similar to those earlier studies I showed, using behavior change techniques such as goal setting, reviewing goals, problem solving are associated with changes in dietary behavior in that study. So the bottom line is that many behavior change techniques, and especially those control theory or self-regulation techniques, which we know are super important in changing behavior, require some sort of active enactment in order to be effective. They require people themselves to take an active role in making things happen. So back to this slide. While these existing behavior change techniques have greatly advanced the science of health psychology and behavior change, they're not comprehensive. They don't list all possible techniques. They have limited examples of each method or technique. They don't necessarily apply to all behaviors. And for that reason, they're not necessarily useful for people in the general public. And they also focus on the deliverers of interventions rather than on the recipients of interventions. And as I just showed, this enactment is really key to behavioral change occurring. And with that in mind, our team aimed to develop a list of self-enactable behavior change techniques, which place the focus on the intended beneficiaries of interventions. And we wanted to create a tool with which people in the general public could read through a menu of behavioral change techniques that they themselves could enact, with clear instructions for how they could do that in their real life to change motivation or behavior. So to do this, we went through a 6-step process where we found all of these existing taxonomies that I mentioned. We conducted a scoping review or scoping reviews in different domains, and we pulled these together and got rid of any overlaps. And then we wrote these instructive examples. Then we did some qualitative interviews to make sure that these techniques were acceptable and comprehensible to people in the general public. And then we had some experts in behavioral change review and give comments. So of the techniques we included, we looked through these taxonomies, and we had these secondary sources, 3 other behavior change taxonomies, one from self-determination theory, one from the Oxford Food and Beverage group, and one list of self-regulation techniques. And then from this scoping review, we identified many other techniques. And these were all comprehensive lists without any sort of limits on which behaviors. So in the end, had all of these sources, we pulled them all together, ended up with a provisional listing. After we pulled in these other sources, we ended up with an expanded listing. And from there, we whittled it down a little bit further. Once we had the techniques that were non-overlapping, we turned them into something that was self-enactable. And we did this within our study team. So for example, there's one technique called social comparison from the Mickey taxonomy, which says draw attention to how others are performing the behavior to allow the person to compare that with their own. And from the intervention mapping taxonomy, there was a technique called provide opportunities for social comparison, facilitate observation of non-expert others in order to evaluate one's own opinions and performance abilities. So we rewrote this in a self-enactable way, which says compare your own performance with that of others. So that's quite clear what the person would then need to do. So that's just how we changed the names and definitions of the techniques, but we also wrote these instructive examples, which should help someone in the general public to enact these things. And yeah, basically here are a couple of examples. So one, focus on past success. Thinking about past successes can give you confidence to do the same again. Each of these instructive examples starts with something of a rationale, then goes on to the instruction, and then tells you about some possible benefits of using the technique. If trying to become more physically active, focus on times in the past when you were active. Think about how you did it and how things were in those times. This visualization can help you to replicate that success in the present day. So, okay. In the end, we ended up with a list of 123 techniques with instructive examples. And we then put this into an expert review phase to get feedback on a number of items. Specifically, do you as an expert understand the purpose of it? Does the definition match with the example? And would a lay person be able to use this? So we identified a few techniques with problems, and those ones that were orange or red here, we rewrote and redid so that, and here's one example. In this technique called emphasize autonomy, that wasn't really clear. Autonomy was a difficult word, and self-determination also a difficult word, so those need to be changed. And this example that we previously had was not concrete enough, so we rewrote it. In the end, the final result is published in Nature Human Behavior, and this is the title. I'll give you a QR code with a link to a free access version of this paper in a second. But what you'll see is that, so here's the link, you can access that. It's a really short link if you want it, but I'll show a QR code in a little bit. Each technique has a name, a definition, an example, and there are 123. I'm not going to go through all of them, but it's a very expansive list, which is broader than any other taxonomy that's out there, or I should say it was until just a few weeks ago when a new taxonomy listing more than 200 behavior change techniques came out. So anyways, I won't talk about that. But basically this compendium is valuable for people in the general public. It's an off-the-shelf resource for people who want to figure out how they might change their behavior themselves. And what you can find from this QR code is a version of the compendium which is specifically written for members of the general public. And it comes with a preface which introduces the compendium and its purpose. It has a glossary which defines some possible difficult to understand terms for people in the general public. And yeah, then it lists the 123 techniques with their names, definitions, and instructive examples. And practitioners can also use this. The instructive examples are meant for members of the general public. So if you see a technique in there that you might want to try or you think might be interesting to try with the patient, you can look in there and read the instruction and possibly just read it directly to a patient and see what they do with it. Now, we don't have any evidence on the effectiveness of these self-enactable techniques yet. It's still early days, but I know there are a lot of groups working with it currently as a sort of self-directed behavior change intervention that's ready to go. So this is the link to the compendium for the general public, and this link is to the Open Science Framework page for the full project, where you can access all of the supplementary files from the article, a preprint of the article itself, and all sorts of information there. I'd like to thank all of the project members of this, especially Nelly Honkonen, who was the PI of the project and had a really great team with lots of experience. And one other thing, I'd like to introduce you to, if you're not already familiar with it, the Practical Health Psychology blog. So Practical Health Psychology is a blog in which health psychology researchers write very short and simple blog posts outlining the key practical messages from their own research. And it's translated into 25 languages at present. And the idea is that it's short and quick and easy and light reading that's accessible to all. And if you're interested, please check it out. It's practicalhealthpsychology.com. And yes, thank you for listening. Happy to take any questions there might be.
Okay, thank you for interesting lecture. Czy są jakieś pytania? Prosimy pytania do naszego prelegenta. I've got one. Have you tested social support techniques used, like, for example, in groups like anonymous overeaters?
No, not so far. I don't know of any. So this was published some 2 years ago, and I don't know of any people who've used it directly as an intervention thus far. A group, a consortium that I'm involved in just recently received funding to build an online system which will help guide people through the use of these self-enactable techniques, but that's still a year away until we have that system ready to test. So there's still some time to go. I see a question in the chat there from Kasia.
Yes. Mm-hmm. What do you think is most important in first starting change?
Yes. So now, if you read the compendium for the general public, it will tell you to start with a technique called agenda mapping, which is the first technique in the compendium. And basically what that is the person thinking about what behaviors they might want to change. So not everybody knows if they even want to change a behavior right away. So identifying a target behavior is a great first step. I wouldn't say that's the most important. The most important technique, I would say, is self-monitoring of behavior. Self-monitoring, as I've described in the slides, is central to the self-regulation processes. And across a range of meta-analyses, it comes up as the technique most strongly associated with behavioral change, and it's consistent across behaviors. So with self-monitoring, you understand where you are, you can compare that to where you might want to be. It allows you to focus attention on the wanted or unwanted behavior, whatever you're trying to change. And it gives you information with which you can set a goal. So if you had to do one thing, I would say self-monitor what you're doing.
Mm-hmm. Okay, it's really important tip.
like keeping behavior change diary or food diary if you want to change some eating behaviors?
Yes, absolutely.
There are some applications that you support?
There are too many to list. There are many, and I understand that when it comes to diet, especially food addiction, as this conference is focused on, physical activity is easy because it's either you're doing something or you're not doing something. Diet is so difficult because there are so many different ways in which you can try to change diet. You can try to reduce fats. You can try to reduce total calorie intake. You can try to reduce sodium. There's many facets of diet that do not exist in physical activity or smoking, for example. So especially when it comes to food addiction, probably also monitoring the cognitions that surround unwanted eating bouts might be a good add-on to just self-monitoring the eating itself. But as for what apps there are, no, I don't. There are too many out there to pick one.
Mm-hmm. Do you think this is the direction for AI to manage your techniques that you develop?
It could be. Of course, with AI, you need to have a lot of data in order for the AI to do anything meaningful. Now, I don't know if you all have played around with the capabilities of ChatGPT or GPT-4 about if you ask it to try to help you to change a behavior, what it actually does. But there's a lot of things in our compendium and in any of those previously published taxonomies of behavior change techniques that are not anywhere on the radar of ChatGPT so far. So it might get the basics, it might get some of these self-regulation techniques, and that's a good start. But in order to identify what is really needed for an individual, you need to know what drives that behavior for the individual. You need to know something about the factors that are really important in that behavior taking place or not. And that's something in a therapeutic setting that we're doing all the time. We're asking questions, we're trying to understand the situations in which the wanted or unwanted behavior is taking place. We're trying to understand what the person might need in terms of knowledge, skills, or self-belief to make the behavior happen. So we're constantly under like researching that in our efforts with patients. So when you have a sort of one size fits all intervention, it doesn't necessarily work. So you need to understand what the individual is doing. So we need a lot of data on what drives behavior for specific individuals in order to guide some sort of an AI, or to have an AI that's informed by all those individual differences in order to suggest the behavior change techniques that would be most effective for that person. So that's, I think, probably 10 or 15 years away in terms of gathering that level of individual hard data that an AI can use to make recommendations on. Mm-hmm. But it's coming. It's coming in our lifetime for sure.
It's really interesting. Czy są jeszcze jakieś pytania? Mamy jeszcze 3 minuty. To pewnie jeszcze jedno pytanie zdążymy omówić. We're waiting for questions. We've got like 3 minutes. Okay, so
yeah, just I'll put in here the link to the Polish version of the Practical Health Psychology blog in the chat there. So yeah, do check that out.
Oh, great.
Well, there's lots of good stuff in there.
Mm-hmm. Thanks for sharing. Yes, sharing your resources. The compendium was my inspiration in writing my book about food addiction.
Yeah. Thank you very much for the invitation. I do appreciate it, and glad to see there's so many people interested in this talk.
So thank you again. Please greet your wife and child.
Yes, will do.
Okay, thank you.
Yes.